We already have a number of questions lined up, and we'll go on with Dr. Coe. Dr. Coe, there's a question here for you. What impact will the Affordable Care Act have on access to HIV testing for at-risk populations and care and treatment for persons living with HIV?
Well, the Affordable Care Act and health reform advances HIV work in so many ways. We have a pre-existing condition insurance plan that covers people who have been chronically ill and have not been able to get insurance for at least 6 months, so that's an advance for people in need right away. So that's on the coverage part. For the testing aspects, health reform promotes prevention in so many ways and expands access to HIV testing in particular, especially for high-risk people. So these are just some of the examples of how health reform can advance public health with respect to HIV and also many other critical areas.
Thank you, Dr. Coe. Let me say that we're very pleased, in addition to Dr. Coe and Dr. Sweeney, to have Dr. Ron Baldessari with us today. He's Deputy Assistant Secretary for Health and Director of the Office of HIV, AIDS, and Infectious Disease Policy. Dr. Baldessari, I think this question is appropriate for you as one of the architects for the National HIV/AIDS Strategy. What needs to be done to meet the goals of healthy people and the National HIV/AIDS Strategy?
Thank you, Dr. Wright. Well, let me start out by saying, for those of you who've read the National HIV/AIDS Strategy, you know that there's a very strong and bold statement in the strategy that says that there are too many people in the United States who are infected with HIV and don't know it. And that's why I think talking about this particular leading health indicator and having an opportunity to hear from frontline community leaders like Dr. Sweeney is so important. If we want to reduce the number of new HIV infections in the United States, a critical component of that response is getting people diagnosed in a timely manner and, as Dr. Sweeney noted, making sure that if they are diagnosed positive, that they're linked into systems of care. This is good medicine, certainly. We all understand why it's important with any kind of condition to have early rather than late diagnosis, but it's also very good public health. We know now, because of the results of a large study that got a lot of publicity last summer, that actually treating people early for HIV infection results in not only improvements to their health, which we already knew about, but results in substantial decreases in transmission of the virus to their partners. So what I would say is that having better information about what populations are infected and may not be aware of their infection, whether that information is by gender or race, ethnicity, or geography, is really, really helpful for health departments and community-based organizations and other primary care providers to target their HIV testing practices.
Thank you, Dr. Baldessari. Dr. Sweeney, I think we have a question for you. You mentioned engaging community partners from the outset and its importance. How did you go about doing that?
We, the team here at DOH, we started by going to opinion leaders, and we got political buy-in. The borough president lent us Borough Hall in the Bronx whenever we needed it, and we got these opinion leaders and each person, and we started inviting the community-based organizations and the hospital leadership, and they were at the table from the beginning. And so that's how we were able to have such buy-in, because they were there from the very beginning using these opinion leaders and champions from the various organizations.
Thank you, Dr. Sweeney. Dr. Coe, I'm going to throw this question to you. It's very troubling to see that so many young people do not know that they have HIV. Why is that?
Well, this is one of the most striking conclusions from the new data that we released just now, and we clearly have the next generation of Americans who are less aware of the urgency of this issue than prior generations, and we are very, very concerned about complacency in younger people. So the fact that we only have some 40% of people who are aware of their status between ages 13 and 24 if they are HIV infected is very, very troubling. So part of the efforts of the strategy of webinars like this, of HIV Testing Day, is to send a message particularly to younger people and make sure that we promote the power of prevention for the next generation and beyond.
Thank you, Dr. Coe. A couple more questions for you, Dr. Sweeney. Can you talk about some of the challenges to HIV reimbursement and how you overcame those challenges?
One of the challenges we had is not in New York State and New York City, I am happy to say. Once you're HIV positive, there is a mechanism in place between our Medicaid system and our Ryan White system to cover everyone who is HIV positive to make sure they're treated. So the challenge is not once you're diagnosed. And we wanted everyone to know that getting a test was not a challenge either, because what we did is the Department of Health gave test kits to many of the community-based organizations who did not have resources to fund testing. And we have a public health lab that was able to do the confirmatory test, again without charge, to the organizations. And so we patched together the wherewithal, the resources to go from testing into treatment without the person having to be concerned about that, because we just patched it together. And one other thing we worked on during the planning phase was to contact various HMOs to make sure that they would pay also for testing for their members.